Can you see my slides?
Yes.
Okay, so good morning, everyone. And I will present an interesting case of mine and Dr. Emily a few weeks ago. This is an avascular thinning bleb after Xen implant. I have no financial disclosure. This is a female patient, 70-year-old. She presented with a diffuse and avascular thinning bleb after her Xen implant before in the right eye. So Dr. Anley decided to remove the Xen, transplanted the amniotic membrane, and then a cyclodiode laser inferiorly. So post-op day 1, the pressure was 90. The amniotic membrane was nicely sutured with corneal edema and deep AC. So the patient was on Duotraf, Diamox 500 milligram BD, and at that time we consider paracentesis. Later on, the pressure is still 95. So the patient was intolerant to Diamox and drops. So Dr. Anley decided to tap the AC, and the pressure reduced to 15 after the procedure with Coleman and no decompressive retinopathy. The patient was on Comigan, Xalatan Azole, and Diamox, and the pressure was checked in every 2 hours. But then the pressure increased again to 90 to 95. And the second AC tap was done by the registrar. The pressure went down again to 20, no decompressive retinopathy, and continued to be checked in every 2 hours. In the late afternoon, the pressure increased again to 60 with corneal edema, deep AC. And after assessing all pathology profile, we decided to give the patient IV mannitol, 20% over 20 minutes. And then the third AC tap was performed. The pressure went down again to 20. And then we checked the pressure at 20. However, pressure still 55. And at that time, we decided to perform an emergent barbell tooth and pseudoblast in the inferior temporal position. Post-op day 1, the pressure was 4, no leak, cornea clear, deep AC, and the tube sitting in a good position with bevel up. And we stopped all glaucoma drops, and we asked the patient to sit upright. Post-op day 2, pressure 10, and the right eye was quiet. And we start atropine 1% once daily, and we discharge the patient. There are some discussion points in this case. I will talk about the complications of Xen Gel implant, about the difference of two positions, and about the amniotic membrane transplant in glaucoma surgery. Just a very quick review. So according to a systematic review, there are several common complications after Xen implant, cited bleb leak, hyphema, transient hypotony, choroidal effusion, and flat AC. And after Xen implant, the most common revision procedure is needling with the percentage varying from 30% to 50% depending on studies. And this is an illustrative case published in Journal of Glaucoma about the Xen erosion. You can see here, this is the ASOCT images with exposure of Xen. And in this case, they use the autologous conch to fix the erosion. About tooth position, I looked at the literature review, and there was a paper published in 2015, and they stated that there was no difference between inferior and superior temporal bevel tooth. In another study published recently about the tooth exposure, they found no difference also regarding the tooth position. This is another paper published in 2019 in Journal of Glaucoma about using amniotic membrane in fixing the avascular bleb, and this case show some promising outcomes. In conclusion, Xen implant can cause several complications, including bleb leak, Xen exposure, hyphema, transient hypotony, choroidal effusion, and flat AC. And needling is the most common revision procedure. There is no difference between superior and inferior bevel tooth, and amniotic membrane transplant might be a good technique for avascular bleb. Thank you for listening.